Hello everyone, it's Schematic Med, and today we're going to talk about management of lower extremity proximal DVT or deep venous thrombosis. If patient presents with lower extremity proximal DVT, which is above the knee, assess if the patient has limb-threatening DVT, which means evaluate for compartment syndrome, which is a surgical emergency caused by increased pressure within a closed muscle compartment leading to severe pain, nerve damage, and potential necrosis of the tissues. And I'm sorry if I pronounce this wrong. We need to assess for phlegmasia ceruleus dolens, which is large occlusive iliofemoral DVT with venous limb ischemia and gangrene, which presents with cyanosis, bullae, massive edema, and extreme pain. If we have anything the above stated, we should do thrombolysis. It can be systemic or catheter directed, or thrombectomy, where percutaneous or surgical. If none of these two conditions is present, we need to assess if we can give anticoagulation. For example, is there any active bleeding or bleeding that is difficult to treat, intracranial hemorrhage? If we can give anticoagulation, obviously we will give it. If we cannot give it, we will consider placing IVC filter. Preferred retrievable one. For IVC filter placement, the relative indications are clot that is spreading despite anticoagulation and decreased cardiopulmonary reserve, for example, impending right ventricular failure. The IVC filter traps clots in transit, reducing the risk of clinically significant pulmonary embolism. Once again, IVC filter is the option for patients with acute DVT and absolute contraindication to coagulation, for example, intracranial hemorrhage, active or uncontrollable bleeding source. Thank you, bye.